Hi, I'm Senuri Alexander, and our group will be talking about the public health issues in Bhutan. Bhutan is a low middle income country located in South Asia at the eastern end of Himalayas. The current population of Bhutan is about 800,000, and Bhutan have offered free universal healthcare for all citizens since 1970. The immunization levels have been maintained over 95%. However, the country still faces many challenges in the burden of health burdens.
My name is Stacy Kimani, and I will be taking you through the health indicators used in Bhutan. The most recent health indicators used to measure the health status in Bhutan are the life expectancy at birth, neonatal, infants, and under 5 mortality. The current life expectancy is at 71 years compared to the year 1985, which is about 50 years. A huge upward trend is seen in the life expectancy at birth. This clearly indicates that the overall health status in Bhutan is gradually improving. According to the World Health Organization, the trends in infants under 5 and neonatal mortality rates also seem to be decreasing, indicating that the number of children making it past their 5th birthday is also increasing. The top 3 diseases causing the most burden in Bhutan by Dalis were low respiratory diseases caused by air pollution, preterm birth complications as a result of conditions such as asphyxia, and chronic obstructive pulmonary disease.
My name is Jaspreet Singh, and we are going to talk about leading causes of death. So most of the causes of death are non-communicable, which are ischemic heart disease, chronic obstructive pulmonary disease, a stroke, internal disorders, and cirrhosis.
So my name is Ekam, and I'll be introducing the 3 public health issues that we chose to talk about. The reason we chose these 3 public health issues is because they have high prevalence rate and they are harming lives of people in Bhutan. So they are excessive alcohol consumption and addiction, type 2 diabetes, and diarrheal disease.
Alcohol consumption is widely integrated in the Bhutanese culture. In fact, the average alcohol consumption in Bhutan is about 8.47 liters, which is much more than the global average, which lies at 6.2 liters. Most of the consumers in Bhutan indulge in heavy drinking, which leads to addiction. According to Mupendi International, alcohol addiction has been classified as an epidemic that is hindering the development of the country and a growing concern, particularly among the youth. This is because alcohol addiction has adverse socioeconomic consequences due to loss of productivity, premature death, and disabilities.
We can divide the risk factors into 2 parts, which are biological and environmental factors. The biological factors are gender, mental illness, and development stage. Studies have shown that women are more at a high risk of being addicted to alcohol consumption more than men. And the environmental factors are home and family background, availability for drugs, school performance, and unemployment. If the parents are addicted to alcohol, there's a high risk that the children would also be addicted to the alcohol. The vulnerable groups are young adults, teens, individuals with mental health issues, and unemployment. For the interventions, campaigns for the prevention of drugs use mainly focused on the youth. Regulation and alcohol promotion and advertising could reduce the impact of alcohol marketing among the young children. Monitoring and surveillance systems are critical to track the trends of alcohol-related harm and to formulate the appropriate countermeasure to assess the impact of interventions.
We highlighted the following action plans to implement our interventions: allocation of adequate funds by the Bhutanese government to cater for the campaigns and other policies. The sale of alcohol should also be monitored and set at a high price to regulate consumption. Retail bar and import businesses should be regulated to reduce alcohol availability among the citizens. Seeking support from institutions and other non-governmental organizations, such as the International Alliance for Responsible Drinking, is key to raise awareness. Lastly, prohibiting alcohol consumption under underage children should also be implemented.
So the next public health issue we're going to talk about is diabetes. Diabetes is a chronic, long-lasting health condition that affects how our body turns food into energy. In Bhutan, there is a very low burden of type 1 diabetes mellitus, while That of type 2 diabetes mellitus is very high and increasing at alarming rates.
I'm Akkash, and when we talk about diabetes, it is a matter of great concern that over 69% of diabetics in Bhutan remain undiagnosed. However, those who are diagnosed do end up getting some form of treatment throughout their life.
The risk factors of diabetes are of two types: biological risk factors and environmental risk factors. Biological risk factor contains genetics and age, obesity and hypertension.
And environmental risk factors contain the stress and physical activities, unemployment, smoking, and etc. Now, when we talk about a public health issue, it is very important to know the vulnerable groups. And in this case, it would be individuals who are of ages 30 to 39. And another group would be those who are from the low income families or those who are unemployed individuals.
Interventions of diabetes. In 1996, the Ministry of Health of Bhutan introduced National Diabetes Program, in which, addressing to the diabetes pandemic, they set up 20 clinics in the country to manage diabetes mellitus. Also, the WHO introduced a package of essential non-communicable diseases interventions for primary care and lower resource setting to promote screening and treatment, which followed up in 2009 and 2013. An audit was also conducted countrywide focusing on diabetes 2 mellitus patients.
On the other hand, when talking about an action plan that is related to fighting diabetes, we have seen that there has been an increase in the availability of cheap insulin since it is the most effective form of treatment. Similarly, diabetics have been classified into two groups, that is pre-diabetics and diabetics, and this allows advanced treatment. Moreover, the government has allocated adequate funds to support anti-diabetes campaigns. This allows the people to understand what diabetes really is and to look forward to what all they need to be doing in the future to avoid a disease of such sort.
So my name is Ekam, and I'll be talking about the third and last public health issue, diarrhea. Changes in the meteorological parameters such as floods, temperature, humidity, and rainfall have been linked to unsafe water. Annual floods can pollute water supplies by carrying germs, resulting in waterborne illnesses such as diarrheal epidemics. In Bhutan, diarrheal illnesses continue to be the major source of morbidity and mortality. Diarrhea was among the top 10 disorders in terms of the number of cases reported in the previous 5 years. The group vulnerable to getting infected to diarrhea in Bhutan is mainly children, especially under 5 children. And to be specific, the group that catches most of the diarrheal infections is 6 to 11 months of children in Bhutan.
I'm Karman Kaur. Talking about the risk factors that are involved with diarrhea, they can be divided into biological, environmental, and lifestyle. The major factors under biological category are malnutrition, age of the person being affected by diarrhea, and zinc deficiency. Apart from this, contaminated water comes under environmental risk factors, which has always been a problem for the Bhutanese government to control. Apart from this, exposed fecal matter and lifestyle problems like unhygienic food consumption also come under the risk factors of diarrhea. Moving over to the interventions, the major intervention that was taken place on the part of the Bhutanese government was the adaptation of UNICEF's WASH program, which stands for Water, Sanitation, and Hygiene. And this was molded and adopted into RSAHP, which is the Rural Sanitation and Hygiene Program, which is being mostly run in rural areas, and it promotes proper sanitation and also helps develop sanitation facilities. And the result of this has been quite out there. First of all, the sanitation coverage has reached up to 60%, and the accessibility to safe drinking water is almost 100%. Apart from this, as Bhutan being a developing country cannot afford rotavirus vaccine, the government has made sure that each and every citizen has accessibility to zinc tablets, which helps in shortening the duration and it improves the outcomes.
Talking about the action plan for eradication of diarrhea in Bhutan, we must provide access to clean and safe drinking water to all and ensure effective and domestic water treatment along with proper storage that can give considerable diarrheal prevention. And we must explain the importance of hand washing and promote sanitation by practices by educating individuals.
To conclude, communicable diseases are being replaced by non-communicable disease in Bhutan at a very fast pace. On the other hand, the public health issues which require attention and have to be addressed are alcohol addiction, diabetes, and diarrhea.
And diabetes mellitus is increasing at a very high and alarming rate in Bhutan. Plus, diarrhea can actually be prevented by drinking safe water. This brings us to the end of our presentation. Thank you.